MDMA is a medication that was invented in 1912 in a lab by Merck Pharmaceutical Company. It is actually the name of a molecule, 3,4-methylene dioxymethamphetamine, which looks like this. The medication is usually taken as a pill. In the 1970s, scientists realized that MDMA could be a powerful addition to psychotherapy, meaning that when it was given and then a person got psychotherapy for things like stress, trauma, or other issues, it appeared to make the therapy work even better. Many therapists and psychiatrists began using it in this way with their patients. Around 1980, people also started using this drug outside the medical context and started calling it ecstasy. Unfortunately, in 1985, the U.S. government made it illegal to use, both on the street and for medicine. A little over 20 years ago, doctors again began looking at MDMA for medical purposes. One area they are investigating is using MDMA for post-traumatic stress disorder, specifically for people who have tried other treatments that didn't work. Post-traumatic stress disorder is a diagnosis that a person gets if they have experienced a trauma or a series of traumas and then have a reaction to it that affects their life and functioning in an ongoing negative way. Symptoms can include flashback memories of the trauma, trouble sleeping and nightmares, and a constant sense of needing to be on guard, hypervigilance, or emotional numbing. Another symptom is dissociation, the feeling that one's body and mind are separated. The fact that this can happen when memories of the trauma occur makes it particularly difficult to treat, because looking into the memory and staying present with the emotions is important for treatment. The diagnosis of PTSD can be made by doctors, psychologists, and others, and is based on a questionnaire called the Clinician-Administered PTSD Scale, or CAPS, which involves a description of the traumatic event and the symptoms. When getting MDMA medication to treat PTSD, a person is first asked to describe their trauma and symptoms, and then a determination is made as to whether this is the right treatment for them. If so, they will then see two therapists, usually a male-female co-therapy team, over the course of several months for a total of around 12 to 15 sessions. Most of these sessions are 1 to 2 hours long, and 2 to 3 sessions are 8 hours long. These longer sessions are when the person receives the MDMA medication, and this also involves overnight stays at the clinic setting. During the MDMA 8-hour sessions, a person lies on a couch or bed, listens to music, and says whatever comes to their mind. They usually spend about half the time listening to music with eye shades on, and some of the time talking to the therapists who are sitting with them. Part of this therapy approach is trusting that a person's mind and body have their own ability to heal. This has been found to be effective for many people so far. MDMA works best for trauma when given alongside psychotherapy. Scientists believe the medication may be working because it can help reduce fear about difficult memories and promotes a sense of trust and safety, and then the person may be better able to process their traumatic memory while still feeling safe. This approach to PTSD has been designated a breakthrough therapy by the Food and Drug Administration, given how promising it looks. The breakthrough therapy designation is for the most important drugs that the FDA is reviewing. Right now, the drug plus therapy combination is in phase 3 research studies, the final stages,